One of the things that we can do is use tools that are out there readily and freely available to help us find people who are willing to get vaccinated. As we've already heard from Dr. Boyd and Dr. Clarko, about a third or so of parents are saying that they're not going to get their children vaccinated, but there's still a majority of people who are at least willing to engage in the discussion about that. And if they're not first in line, they're at least willing to have the talk. So this is an example, a couple of screenshots that I took from vaccineplanner.org, which is a wonderful tool that's been put out by Ariadne Labs and Boston Children's Hospital. It is free, and you can go on and pull up your state. And what the colors mean is that the tan areas are areas that are considered vaccine deserts. So this means that there is not a vaccine provider for COVID-19 vaccine within a 15-minute drive of people who live in those tan areas. And the little red circles are providers that are not participating in the COVID-19 vaccination program right now, but who could. And you can see that many of those providers are sitting right smack in the middle of those vaccine deserts. And so if we can work to encourage those providers to get on board with the COVID-19 vaccine program, then they can start to vaccinate people who are in those areas. And then the purple areas that you see are areas where people have said that they've not yet gotten vaccinated, but they're willing to do so. And so again, if we don't have providers in areas where people are willing to get vaccinated, then, and it's not necessarily the top thing on their list to go get done, and there's a considerable distance to find a vaccination site, then those people are sitting there still at risk, but actually willing to get vaccinated. And that's on the order of thousands of people in these states that are there and willing. And so using something like this tool at vaccineplanner.org can help us go in and locate zip codes and neighborhoods and areas where we can take mobile vaccination units and buses and put up vaccination sites in faith-based centers or community centers or Boys and Girls Clubs or YMCAs to help get people vaccinated who are in those areas who may not otherwise access that. So I would highly encourage you to go and look at tools like this that are readily available for you, that have wonderful data that's improving all the time. This site even now can help us identify areas that don't have pediatric vaccine providers specifically, so that we can try to locate pockets of children who need to be vaccinated, who may not have ready access to do that.